Good afternoon. Thank you for having me today. Wonderful meeting today, and I'm really happy to present. I will be presenting, my talk will be a little bit different from the previous one in that I'm going to present a very large program called HBM4U and the following program called PARC. So this will be quite a large overview with some snapshots here and there to let you know what we are doing in those big programs. So let me start with the Human Biomonitoring Initiative, Human Biomonitoring for EU, for Europe. That's the name of it. And this is a 5-year program. It's actually started in 2017, will probably end by the end of 2021, and will probably actually be extended for a few months after that because of the COVID situation. This is a very large program. There are 30 countries, as you see, almost all Europe is there and beyond. And there are 120 partner organizations. It is led by UBA, the German Environment Agency. And basically, the major aim is to harmonize procedure and tools for human biomonitoring at the EU level and carry a human biomonitoring survey at the EU level. We already have some human biomonitoring in Europe, but it's in some countries, there is some human biomonitoring, but basically, the aim of HBM is really to harmonize and to carry out at the EU level human biomonitoring study. But it's not only that, it's actually also on identifying the substances that are in blood or urine, but also understanding what do they do for our health. I mean, these are the objectives here. So let me summarize this here. Basically, what we are doing is identifying the internal dose, as I said, in blood and urine. That's the main objective of human biomonitoring, but there are also objectives in knowing where it's coming from, what are the sources, and mostly what is the impact on health of these chemicals that are in our blood, and using the frameworks that are now done in toxicology, such as the adverse outcome framework, for example. So these are the major aims, and this actually scheme summarizes basically the whole picture. So it's quite ambitious in a way, but there are many partners, and we have started. So this is to summarize for you what we call the legacy until now of HBM for EU, such a big program. And I will take some of these different outcomes one by one later and try to give you some snapshots on them. And of course, the program is based on science to policy interactions. I mean, we are here to basically do something that is useful for regulatory or for policy. In order to do that, and since it is at the EU level, we needed to start by doing a lot of networking, partnerships, and creating communities. And I will give you some examples of that. And also creating infrastructure, the EU platform for human biomonitoring, of course, but also the analytical laboratories, how to do the surveys, exposure modeling, etc. And of course, we have identified and made some really important findings here. And this is obviously the aim of such a project. Let me take some example. For example, the networking here. In each country participating in HBM4U, we have a national hub that actually links all the partners from a single country and actually supports the European HBM4EU by providing answering surveys, networking within each country, the partners that are involved, etc. So this is actually has been very successful, and it has been very important to sort of network the partners involved, not only in human biomonitoring, but more than that, actually in environment and health in general. The second example about the science to policy interaction, we have developed a prioritization strategy in order to check which compounds are we working on. So this arrow actually represents all the steps leading to the prioritization of the chemicals that we have been working on. And of course, it starts with the surveys. It starts also with stakeholder survey, workshops with stakeholders. We review these candidate substances, score them, involve focus group, make additional consultation at the end together with the European actually regulatory agencies and policymaker decide on which are the right substances. So it's quite a long process, but I think this is important because it involves everybody, and so that everybody is convinced that what we are working on has some policy implications. So we started with a first list of priority substances that you can see, many of those you know about. I mean, bisphenols, perfluorinated compounds, we just heard about them, phthalates and others. And we have now a second list of priority substances that we are currently working on that are listed here, among them pesticides, of course, and very important substances. And we will be starting another round of prioritization that will actually be most of the research on which will be carried out by the next program, which is PARC, as I will tell you a little bit about it a little bit later. So infrastructure, what did we do in terms of infrastructure? We have actually worked on networking many analytical laboratories, and let me show you one example here. These are laboratories on targeted assays. Of course, obviously, in human biomonitoring, we do a lot of targeted analysis because we need to quantify the substances. That's what is needed, and that's how we can tell, and later using guidance values, health-based guidance values, whether we have a high amount of such compound or not a high amount of a compound in our blood. So we needed to quantify, and to be able to do that at the EU level, we have actually now a network of dozens of laboratories and sometimes more all around Europe that are doing the different assays. And we have a very efficient, actually, quality control scheme that has involved, and for each compound we qualify the lab for their capacity to assay, so that we know that if we are assaying in a dozen of laboratories or 2 dozens of laboratories, if we are assaying bisphenols, then it's the same quality controls that are applied, and we can compare them. We developed new methods also, but harmonization and quality control has been a major effort that we have done in this respect. But we don't do only targeted assays, we also do suspect and non-targeted screening, as we have seen a little bit earlier. And there are different activities here. I will come back to this a little bit later, but among the most important activities is that we have gathered a number of laboratories doing such assays, and the main objective is to harmonize the work, to provide guidelines for improved harmonization of these assays. And we know how complex they are, we've heard about that, but we need them to be harmonized if we want to do such assays at a very large scale. And this is what we have started doing, actually, with some success. So that's an important assay. These are the important objectives. Obviously, infrastructure is also about the European platform for human biomonitoring and the data management. Let me give you what we have been doing. It's what we call the aligned studies. These are studies that are carried out in the different European countries, a large number of European countries. Some studies are about children, as in children, others about teenagers, and others about in adults. And we do not assay exactly the same compound in the different groups based on the needs that have been gathered during the prioritization process. And basically, so now we can do, for example, in children, we have a number of countries that are involved. They do the assays and the surveys exactly the same way. There's a harmonization of the surveys and so that the results can be comparable at the end. This is obviously one of our major efforts here, to have a harmonized European human biomonitoring. Let me give you just an example. This is not with the Align study. This is actually using other data that have been produced in Europe. What we can do is do time trends. For example, this is on phthalate, on one of the phthalates, showing that it has been decreasing in Germany and Denmark. And the second example to the right is about bisphenols in different studies across Europe, showing in fact that there are, the averages are slightly different, and we don't really know exactly why there is such a variability. Of course, we will be able to answer this once we will have the aligned studies, which are much more harmonized and much more controlled. and we can really tell whether there is a geographical difference or whether was just due to the differences in the different surveys that have been done in this study here. So these are the kind of studies that we can do with human biomonitoring. But as I said, it's not only about assaying compounds in blood and urine, it's also about trying to understand and linking the exposure to these compounds with health impact. So we had a number of work packages in this human HBM4EU on trying to link the internal dose to either the sources or most likely to the impacts. And let me show you a couple of examples. For example, we have developed a computational platform on exposure pathway and internal dose modeling. It's really shown actually here, starting with the human biomonitoring data and using exposure modeling, trying to see where is it coming from, basically. And that's actually what the policymaker need to know to take some decisions. So this is in HBM4U, this is done purely through a computational programs. We do not do assays in the environment. This will be different in the next program in part. And also we do internal dose modeling so that we can tell what is the expected amount of compounds in the target tissues, so that we can, that's where the toxicity actually would be coming from. So this is an example of a PBPK model concerning the placenta, because there's a lot of work that is being done in Europe on birth cohorts. So it's really important once you assay in mother blood to know how much is in the fetus blood. So this is the model to the left, and you can see the modeled amounts in the fetus along the gestation of along pregnancy. So these are the kind of studies we do with PBPK. We also do a lot of work on so-called adverse outcome pathways. You know, this is the framework that is now much used in toxicology, where we describe the different steps from the initial molecular event, for example, receptor activation or enzyme inhibition, all the way to cellular effects, then tissue-like effect, all the way to the adverse outcome. And what we have been doing is to develop actually a computational program to link substances, priority substances that we are working on, to different events along different adverse outcome pathway based on the survey of abstract from PubMed and on systems biology. We really use a lot of text mining here with AI, with scoring function, to get a better idea about how the substances that we are working on are linked to health effects. And the example that is given here is that we have been able to link bisphenol S, which is, you know, what is supposed to replace BPA in many compounds, linking bisphenol S to metabolic diseases and obesity, just through surveying the millions of PubMed abstracts and doing some systems biology on it. We have done that also on the different pesticides. These are the second list of priority substances. And we have developed a web server that you can see here, AOP4EU Pest. This is a web server where we link one pesticide, for example, here, to different outcomes from the literature. And then if you click on each dot here, you can have all the papers that have shown that there is a link between this compound and this effect. So this can be used, and it's readily used. And we have done this for like 36 pesticides. The other important issue is to develop, mostly based on AOPs, actually, innovative effect markers. We have first listed the different effect markers from that are linked to the first round of priority substances. You can see here classical or less classical effect markers and some novel effect markers, because we're trying to see whether we can develop new and relevant effect markers. These are not like large-scale metabolomic or proteomic studies. These are targeted, actually, effect markers that we would like to quantify and use in our surveys. And let me give you an example about some epigenetic markers that we have used. We have actually assayed the methylation in brain-derived neurotrophic factor in one of the exons, and we have been able to show that there is a connection first between, in a cohort study called INMA, between bisphenol A exposure and some neurocognitive problems, and between bisphenol A and the methylation of BDNF, and between the methylation of BDNF and the neurodevelopmental problems. So we think that this is a good, and this is still ongoing. I mean, this has to be confirmed, but we think that epigenetic markers could become really very nice effect markers in the future, especially in birth cohorts. We have also been doing, actively working on mixture study, either trying to statistical analysis to identify from human biomonitoring study what are the most likely and realistic mixture. We have also carried a pesticide hotspot study where we have compared people living close to orchard agriculture areas and controls, and assayed using suspect screening the different pesticides in their blood, as well as other case control case studies that are shown below. But concerning the specimen project, this is the pesticide, the hotspot pesticide study, we have been using the suspect screening that we have developed to identify whether people living close to these agricultural areas, farms, etc., are more likely to have pesticides in their blood than the other controls. We have actually a specific work package on these non-targeted screening assays and suspect screening assays, and this work package has different aims. I have just talked about the mixture study with the suspect screening of pesticide here, but we are also working on developing, identifying emerging substances, mostly halogenated marker, starting from actually a blood analysis. And we are also doing work on the list of emerging chemicals, similar to what has been shown by Dr. Ferguson earlier. So there is a work on these emerging substances. Many EU agencies are very much interested in that. We are all the time trying to connect to policy makers, and we are trying to actually respond to what their needs are. For example, recently, DG Santé, the Directorate on the Health in Europe, asked us to work on copper, and we have immediately identified all the studies that have been done on copper across the EU and provided them with some answers. So basically what we are doing, what we would like to do is to consolidate exposure assessment, do effect analysis, as I said, toxicity analysis, and therefore to be able to use these approaches for risk assessment. So we are using traditional human biomonitoring approaches, but we are also using other approaches that I have tried to overview with you today. Now, it's nice to have a 5-year project on human biomonitoring, but it's really important to have a sort of sustainability of these activities across Europe. So this is a Horizon 2020 program. We hope at one point we will have a completely sustained human biomonitoring activity across Europe, maybe with an European agency. But in the meantime, when HBM4U ends and before the start of a more sustainable activity, we needed another intermediate project that would carry these legacy of HBM and improve it to a certain extent. And this is actually what is being prepared now. We are not sure it will be successful, but we are quite confident. We are preparing a new and actually bigger project. This bigger project is called PARC. It's a partnership for the assessment of risk of chemicals. It's built on the legacy of HBM4EU, so it will do and continue human biomonitoring as it is done, but it is also built on another initiative in Europe, which is called EUTP, EU Toxicology Program, which is very similar to the NTP that you have in the US. And both together will be combined in a very large partnership with obviously risk assessment, combining both, as well as other additional activities. For example, there will be more environmental studies in PARC, more studies on mixture, and also an approach of safe and sustainable by design. So this is quite a large program. It will involve, I think, a lot of people. We started working on it. There are many challenges. It is really policy oriented. I mean, it is oriented to address policy questions that are asked by EU and national agencies. and identifying the gaps and filling the gaps and developing new methods that will be used in the future. So it is funded, it will be funded by Horizon Europe, and we already have 25 countries that are participating, and probably more will join later, and a number of all the major European agency as well as the JRC and the different directorate are participating to this concept. It's larger than HPM4U because it includes all these toxicology studies in addition to what we have been doing in HPM4EU. And this is the outline of what it will look like, a number of different work packages. I will not go through these. This is what we aim to do. Of course, this is a science to policy program. There will be a work package on monitoring and exposure, both in human biomonitoring, but also in the environment. There will be hazard assessment, a strong work package on hazard assessment, and a strong work package on regulatory risk assessment, as well as other work packages that will support the use of data, interpretation of data, developing additional facilities and capacities in the EU. With that, I would like to thank you very much and thank the Marieke Colosa from UBA, Elena Taroja, who's helped me with this, as well as Pascal Sanders and Adrian Pittman, which will be the future coordinators of PARC. They are from ANSES, the French health security agency. Thank you very much.